criteria, however, was that there could not be any contamination. That if any contamination got into the resin, they could not use it in subsequent production processes. And so this architect, along with his team of engineers, worked on it diligently, ran loads of different concepts and tests, and they got to 99.7% of getting this resin uh, where it's clean, except for like 0.03%, there was still some contamination. And so he had this report about all the things they did and all the calculations they did, and they're now ready to deliver it to the client. And so I read it through and I said, um, it said that whatever you came up with would not do the task unless there was zero contamination. And he sat there and he looked at me and he said, but look at this work we did. Look at how much we did. And I said, I understand it's really great work that you did, but it doesn't solve the problem. And I think, I thought of that story as an intro to a discussion about coronavirus because it doesn't matter if you do everything right for a week, for 2 weeks, for 3 months, for a year. If the threat is still there and you don't do what you have to do and you become exposed, the virus doesn't say, well, I'm not going to hurt you so bad because you worked so diligently for the past year and a half. It's going to hurt you. And so I think it is imperative to understand that um, that it's we really need to be vigilant, and we really need to listen to the scientists and be vigilant in what we do. So where I feel that we have been, there's many people who feel that if we get over this hurdle, this current episode that we're going through, that if it gets under control and we see the numbers coming down at the end of April or May or June, then we'll be able to lighten up and loosen up and get back to normal and whatever that might mean. There's also many organizations who are saying, well, we're not sure of when we'll start the baseball season. And well, maybe we'll put the golf thing out in Augusta in November sometime. Um, all of that, in my mind, is not addressing the reality that I'm hearing from the epidemiologist. They are saying a minimum of a year, probably 18 months, maybe longer. And I think that that message is a very important message. And that is what I want to be able to communicate through this 1 hour class today and the 1 hour class that we'll have next week. So, um, the virus it's a respiratory virus, spreads people to people. The estimates that I've heard, and this has remained consistent from what was communicated in January and December, uh, over half the population of America will be infected. 160 million people will be exposed. 80% of them will have mild symptoms. Many may not even know they've ever had it. 20% will have severe symptoms, of which 1 to 4% will result in death. That's 1 to 4% of the 20%. The idea of the quarantine is not to defeat the virus, it is to slow it so that the health infrastructure is not overrun. What do we have with the healthcare infrastructure? Well, as we have moved into for-profit hospitalization and healthcare, we went from hospital capacities of 75 to 80% to 90 to 95%. it means that we don't have spare beds. It's a real problem. There was a emergency medical guru from Israel who came to give a lecture at the Rollins School about 3 years ago, maybe longer. And he was talking about how they prepare for disasters in Israel. And he talked about all the great stuff they were doing and how they were prepared. And raised the question to him, what level of capacity do you keep your hospitals at? 60% is what he said. We don't let hospitals get beyond 60%. If we let them get above that, our emergency plans don't work. So it's important to recognize that we're in a particular condition that is not conducive to dealing with this pandemic. We also have the phenomenon of government reductions in expenditures on public health. And this ties into a broader trend that has gone on since the 1950s, which has been an assault on government, an effort to rail in government, slim it down, cut programs, cut expenditures, cut taxes, and on and on. You've heard it many times, and we've talked about it in classes many times. And we may do a class just on that topic, so people really have a broader understanding of how we transformed from the united country of World War II to the fractured country of 2020. Anyway, as a result of that, public health has been cut a great deal. The infrastructure for public health officials to monitor pandemics, viruses in foreign countries was reduced dramatically in recent years. And so we've been really without the protections that we might have had at another time. Right now, the severe need is for testing, personal protective equipment, hospital beds and equipment, hospital staff, and social distancing. And by all indications, that is going to be the mantra for the next 12 to 18 to 24 months. With testing comes data that can facilitate a more strategic response. However, we have really not begun that at all. If you look at South Korea, they have implemented extensive testing and have been able to, quarantine areas and people, but not have to shut down their whole country. And what they are using is a telephone app that tracks you. So if I have tested you, you then get entered into a database, and they monitor where your phone goes, presumably where you go. And if you come in contact with someone who then subsequently tests positive, they'll track you down to say you've been exposed to someone who tested positive. So it's a one of those things that people who want privacy will certainly object to, but that is what is being done in South Korea. China is also implementing similar techniques. And the other point is that we may be in an emergency state for 12 to 18 months, possibly longer. And it is important to keep in mind the Black Plague, which altered history, lasted for 4 years and killed half of Europe, maybe more than that. Okay, so I want to show you this clip of Bill Gates, who was speaking in 2015 after we had the Ebola crisis. But first, let me first come up for air and ask if anybody has anything to say And Valerie, if you're on and you can unmute people so they can ask questions. Maybe we can't do that. I don't know. Okay, there we are. Anybody have anything they want to raise just yet?
No.
Sal,
Yes.
can you go back a screen for just a minute, please?
Oh, wow.
No, the other direction. Yeah, right there. So reacting to events versus a strategic plan is the goal, right? No, it's not the goal. That's what we're doing.
The point that I'm making there is that we are reacting to the event of the moment and not operating on the basis of a strategic plan.
Got it.
And
Thank you.
Yeah, and the idea of the strategic plan is let's look at what is the landscape that we're in right now. How do we go back to work? What are, within the constraints of the modern day, of the pandemic, what are the tools that we can use to return to work and do other things? And that's, for a lot of businesses, that is really the critical thing for them now. To say, this is our landscape. Now, what are we going to do? It's like the
Background noise.
center in having to say, you know, this is where we are. How do we, the senior center, now adapt to the landscape and deliver services, but deliver services in a different way than we did before?
Thank you.
Got another question, Sal.
Yeah.
Black Plague lasted 48 months, but this is technologically, we know more.
It's putting it in.
Couldn't that cut down the time period dramatically?
It could, and I think that's why you have the epidemiologists saying a year to 2 years to come up with a vaccine. You know, certainly they didn't come up with a vaccine in those 4 years for the Black Plague. Basically, what happened is everybody had died, and the bug didn't have anywhere to go because it was only dead people around it, and people who had survived, who then had antibodies, but they didn't know that they had antibodies. So it was it just didn't have another host to go and attack, and so it eventually fizzled out. Which is what's happened with most of these pandemics, is that the bug fizzles out, but because it's killed everybody, you know. Okay, so we'll Valerie, if you'll mute everyone again, and we'll take a look at Bill Gates. Come on.
When I was a kid, the disaster we worried about was a nuclear war. That's why we had a barrel like this down in our basement filled with cans of food and water. When the nuclear attack came, we were supposed to go downstairs, hunker down, and eat out of that barrel. Today, the greatest risk of global catastrophe.
Hey, Sal,
Yes.
you can't hear much on here at the Ratliff household at Penny and Dean's.
You're not getting enough sound coming through?
Now it's good. Thanks.
It's most likely to be a highly infectious virus.
Let me see what I can do.
Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount.
Sal, I'm not getting anything.
No sound? Okay, hang on. No, that ain't it. Okay, that's muting it.
and put that plasma back in people to protect them. But
How's that?
try.
No, I don't see or hear the TED Talk.
These things are really a global failure.
Sal, maybe try opening it up in another window.
I don't see it or hear it either.
I'm sorry, Valerie, are you getting anything?
No, maybe try opening it and like clicking on it to open it in another window.
Okay. Okay. Let me try it this way. All right. If I share, if I put them over here, hang on. Come on. That's not what I want. Let me try it out of here.
Sal,
Yes.
look to the button bottom left next to start video. There's a little up arrow. Click on that.
I don't, hang on, I don't have that. Hang on.
You don't?
Oh,
No.
No, it's up on the top. I have start, no, that, I won't, I don't have a video connected like that.
There you go, Sal.
Huh?
I'm gonna ask to remote into your screen share. And if you'll accept it, I'll try to
Okay.
there we go.
No. I can try it like this.
Valerie, I found the button. It's next to start video. It's an upward button and opens up a whole sound possibility. You
Yeah,
see it?
right. That's not for the link though.
That's what.
I gotta mute her. Let's see. I'm gonna unmute Sal and mute. All right, Sal, did I mute you? No, you're
No,
there.
I'm still here.
Okay, Barbara. All right, Barbara, are you there?
Yeah.
Okay, sorry.
There's another button to the left and it has audio settings. The bottom.
You need me to do that. Okay. You know, it's funny because I had it come up when I tested it a few minutes ago.
Yeah, we tested it and it worked.
Right.
It's okay. Maybe go back to the slideshow.
Okay. And see if it works from there.
Mm.
If you, okay, Valerie, if you, you have, where you have control over my screen.
Yeah,
now?
there you go.
Okay. So now I got it, right?
Yes.
Okay. Let me just see if I can do it, if it'll come up like that. Okay. Then let me try this one from the current slide. Let's see if we get something here. Okay, let's see if we get something. Are you getting anything?
Can you turn it up on the YouTube video?
I think I have this sound up as much
When I
as
was a kid, the disaster we worried about most
uh,
was a nuclear
you're
war.
not getting any sound.
That's why we
No.
had a barrel like this.
It's just
Is
very
that right,
low.
Pat?
Filled with cans of food and water. When the nuclear attack came, we were supposed to go down.
I don't understand why it's not. giving me
Eat out of that barrel.
anything.
Today, the greatest risk of global catastrophe.
It's as if I don't have any control.
Instead, it looks like this.
Okay, let me try it here. Okay, Valerie, did you get any sound coming through?
No. So what I
Okay,
can
let me try
do,
a different slide then.
okay.
Let's try this one. This is weird because it worked the other day when we did it. I don't know why it wouldn't be coming through now. Maybe the muting? Did that have something to do with it?
No.
Nope. Nope.
Okay. Well, it's calling it up, but it won't. Here we go.
I'm gonna go into the email, Sal, and
Okay.
and I'll just share the video. I'll share my screen for the video.
Are you getting any sound now?
No,
That's why.
but that's okay. We got it. I'll do it this way.
Is that any better?
No, I don't hear it. Let's see.
Valerie, what happens if he does go into Zoom? Is he not on Zoom?
Yeah, he's on Zoom. Okay, Sal,
Yeah.
I'm going to share my screen real quick.
Okay.
So and we'll just do it that way. Yes. Everybody hear that? Thumbs up if you can hear it.
No.
When I was a kid, the disaster we were about was a nuclear war.
Better.
That's why we have a barrel like this down in our basement, filled with cans of food and water. When the nuclear attack came, we were supposed to go downstairs, hunker down, and eat out of that barrel. Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. Let's look at Ebola. I'm sure all of you read about it in the newspaper. Lots of tough challenges. I followed it carefully through the case analysis tools we use to track polio eradication. And as you look at what went on, the problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces. We didn't have a group of epidemiologists ready to go who would have gone, seen what the disease was, see how far it had spread. The case reports came in on paper. It was very delayed before they were put online, and they were extremely inaccurate. We didn't have a medical team ready to go. We didn't have a way of preparing people. Now, Medicine Sans Frontières did a great job orchestrating volunteers, but even so, we were far slower than we should have been getting the thousands of workers into these countries. And a large epidemic would require us to have hundreds of thousands of workers. There was no one there to look at treatment approaches, no one to look at the diagnostics, no one to figure out what tools should be used. As an example, we could have taken the blood of survivors, processed it, and put that plasma back in people to protect them. But that was never tried. So there was a lot that was missing. And these things are really a global failure. The WHO is funded to monitor epidemics, but not to do these things I talked about. Now in the movies, it's quite different. There's a group of handsome epidemiologists ready to go. They move in, they save the day, but that's just pure Hollywood. The failure to prepare could allow the next epidemic to be dramatically more devastating than Ebola. Let's look at the progression of Ebola over this year. About 10,000 people died, and nearly all were in the 3 West African countries. There's 3 reasons why it didn't spread more. The first is there was a lot of heroic work by the health workers. They found the people and they prevented more infections. The second is the nature of the virus. Ebola does not spread through the air. And by the time you're contagious, most people are so sick that they're bedridden. Third, it didn't get into many urban areas, and that was just luck. If it had gotten into a lot more urban areas, the case numbers would have been much larger. So next time we might not be so lucky. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. And so there are things that would literally make things 1,000 times worse. In fact, let's look at a model of a virus spread through the air like the Spanish flu back in 1918. So here's what would happen. It would spread throughout the world very, very quickly. And you can see there's over 30 million people die from that epidemic. So this is a serious problem. We should be concerned. But in fact, we can build a really good response system. We have the benefits of all the science and technology that we talk about here. We've got cell phones to get information from the public and get information out to them. We have satellite maps where we can see where people are and where they're moving. We have advances in biology that should dramatically change the turnaround time to look at a pathogen and be able to make drugs and vaccines that fit for that pathogen. So we can have tools, but those tools need to be put into an overall global health system, and we need preparedness. The best lessons, I think, on how to get prepared are, again, what we do for war. For soldiers, we have full-time waiting to go. We have reserves that can scale us up to large numbers. NATO has a mobile unit that can deploy very rapidly. NATO does a lot of war games to check are people well trained. Do they understand about fuel and logistics and the same radio frequencies? So they are absolutely ready to go. So those are the kinds of things we need to deal with an epidemic. What are the key pieces? First is we need strong health systems in 4 countries. Where mothers can give birth safely, get all their vaccines, but also where we'll see the outbreak very early on. We need a medical reserve corps. Lots of people who've got the training and background who are ready to go with the expertise. And then we need to pair those medical people with the military, taking advantage of the military's ability to move fast through logistics and secure areas. We need to do simulations, germ games, not war games, so that we see where the holes are. The last time a germ game was done in the United States was back in 2001, and it didn't go so well. So far, the score is germs 1, people 0. Finally, we need lots of advanced R&D in areas of vaccines and diagnostics. There are some big breakthroughs, like adeno-associated virus, that could work very, very quickly. Now, I don't have an exact budget for what this would cost, but I'm quite sure it's very modest compared to the potential harm. The World Bank estimates that if we have a worldwide flu epidemic, global wealth will go down by over $3 trillion, and we'd have millions and millions of deaths. These investments offer significant benefits beyond just being ready for the epidemic. the primary health care, the R&D, those things would reduce global health equity and make the world more just as well as more safe. So I think this should absolutely be a priority. There's no need to panic. We don't have to hoard cans of spaghetti or go down into the basement, but we need to get going because time is not on our side. In fact, if there's one positive thing that can come out of the Ebola epidemic, it's that it can serve as a early warning, a wake-up call to get ready. If we start now, we can be ready for the next epidemic. Thank you.
Now,
Yeah, okay. Valerie, if you'll queue up the next one, I want to play an interview with Dr. Osterholm. I wanted to highlight the Bill Gates TED Talk. Again, this was in 2015. It's after Ebola. But mind you, George Bush in his administration recognized that a pandemic was a great threat and started to put together an infrastructure to be able to respond to it. Okay, do we have Dr. Osterholm next?
Next is the,
Right, CNN and let me see, it'll say, yeah, CNN, Michael Osterholm.
okay, yes. All right, so here we go.
You're first. First to respond. First to put others' lives before your own. And in an emergency, you need a network that puts you first. That connects you to technology and each other.
Commercial
That's built with
that allows us to get access to their video.
FirstNet, the only officially authorized wireless network for first responders. Because putting you first is our job.
Let's bring in Michael Osterholm. He's the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. We should point out that Mr. Osterholm's been warning the United States for decades that we're ill prepared for a situation like this. Mr. Osterholm, you started warning the United States about biological warfare in the 90s, and then in the early 2000s, you started talking about how the U.S. is not prepared for a pandemic. Are we better off now than we were when you started warning us?
Actually, we're not. That's the sad commentary. One of the key elements for responding to a pandemic like this is having a robust and capable healthcare system, along with a robust private sector that can make the kind of drugs and so forth we need. And in each instance, the healthcare system today has no excess capacity whatsoever, not even the ability to stockpile these masks and so forth that we need. And the private sector is all just-in-time delivery. So again, we're not going to see a bolus of what we need coming down the pike.
Well, that's terrifying. And let me ask you, I want to get your reaction to some breaking news. There's a report from Italian health officials saying that on average, people in Italy, people who die from the coronavirus, are dying 8 days after they first show symptoms. What does that suggest about the timeline we may face here in the United States?
Well, first of all, the timeline for dying is very different than the timeline for new cases. And in China, many of the patients didn't die until the second or third week after their onset. But every day beyond day of onset that they need a hospital bed, it just ties that many more up. And this is why we're not only talking about the number of patients coming to the hospital needing care, but the fact that many of them will be there 3 weeks or more in intensive care. So that's a real challenge.
We heard the Trump administration describe new steps they're taking to combat the virus today, including invoking the Defense Production Act to make more medical gear, sending 2 hospital ships to New York, deploying 5 million new masks. You just heard the Secretary of Defense talking about some of that. What else does the Trump administration and local and state governments, what else do we need to be doing?
Well, first of all, we have to have straight talk right now. Let's just go through that list you just gave us. The Defense Medical Act, it's a cosmetic event. Already, all the companies that could make the protective equipment we need have been making it for several months, 24/7.
So we have no additional benefit there. There is nothing magic that's going to happen with this. To get a new a plant up to make N95 masks takes years. It's not something that can happen overnight. As far as the Defense Department, we welcome any help we can get, but we need several hundred million N95 respirators we're short of right now just to meet the minimal care that we think is going to be required. 2 million is a great number, but that's like trying to fill Lake Superior with a garden hose. So I think that what we just want right now is straight talk. What are we going to really do that's going to make a difference? And if it doesn't make a difference, then how are we going to get through? And I think that's what healthcare workers want to hear right now about what they're going to be able to do, how they're going to be protected. You also mentioned the issue about bringing back retired doctors, nurses. That's not a good idea. And the reason I say that is as much as they can help, and they surely want to help, they're the very same people at the highest risk if they do get infected of having a very bad illness themselves. And if we can't protect them at the hospital because we don't have the gear, I don't want to see them become the next casualty line that we're going to have to deal with.
Well, obviously, you wouldn't want to bring them back if we don't have protective gear. It's an excellent point. Dr. Deborah Birx, who is leading the White House Coronavirus Task Force, said this afternoon that the information they're getting from other countries shows that younger people, such as millennials, Generation Z, may actually be at greater risk than had previously been thought. She noted there are cases of millennials being sent to the intensive care unit with coronavirus in France and in Italy. This is not just contracting it, this is being sent to the intensive care unit. How might that change the calculus for how the U.S. deals with the virus?
Well, first of all, these cases are obviously very tragic. We know, for example, the young Chinese physician who first indexed this outbreak in China on the internet died as a result of this infection. I would just be a little cautious interpreting these because each death, as tragic as it is, there are many, many individuals in this age group are getting infected. So unlike in China, where 10 to 12% of those over 65 who smoke or male die, this still may be one of those situations where 1 out of every 1,000 or more infected die. But I want to make it very clear, yes, young adults are vulnerable to this, not only getting infected, but also rarely, but nonetheless, very importantly, having a very, very severe illness and potentially even death.
And Ron Klain, who was the Ebola czar during the Obama administration, he said on CNN today that some hospitals are going to start reaching their breaking points as soon as this weekend. Do you agree with that?
Absolutely. I think Ron's assessment's right on the mark. And the thing that I think is also being missed, though, that's this weekend. As you talked about in the lead into this segment, we're talking about potentially 12 or 18 months of this. And so while we have to plan each day's battle, as has been said, this is a war. We've got a number of days of battle to do. So we have to figure out now, how are we going to get these hospitals through, not just today, not this week, not next week, but potentially months of being under siege with these cases.
All right, Michael Osterholm, we always appreciate your expertise. Thank you so much. Good to see you again, sir.
Thank you, Jake. Good to talk to you again.
Okay, Valerie, as you queue up the next one, the
investors
sorry.
in India today hailing the arrival of a famous real estate tycoon named Trump, but it's not the president; it's his son, Donald Trump Jr.
Sorry.
Who's there to drum up interest.
That's okay. While you're getting that up, I just want Osterholm is from University of Minnesota, and I've included a bunch from him because he has been the most consistent and has spoken the most about hunkering down for the long haul and not getting distracted by quick fixes, and also calling for a comprehensive plan that it's not going to be just getting testing. Testing is very important, but as he says, it's not a silver bullet. It's not the answer to everything. It has to go in conjunction with a plan of how you're going to track people, how you're going to isolate places where you have outbreaks and that sort of thing. That you can't just look at one element and think, well, if we get that right, we'll be fine. All the pieces have to come together.
Oh, okay.
Okay, you ready on the next one?
Ready? Yes. Let's see. Share. Well,
I knew nothing at all about working in front of a camera.
I had an agent, and he just looked at me and he said, "You're never going to make it at stand-up."
You don't have to get it right at the beginning.
There is always a different way to grow, to learn, and to approach it. Start it somewhere and see what people like.
The time is now for you to start your journey to find ways to get better. That's why we're all here.
For more on the fight against coronavirus, we want to welcome Michael Ostrom. He is the director of the University of Minnesota's Center for Infectious Disease Research and Policy. Help us this morning. What are you seeing out there that's positive? I'm hoping.
Well, I think, well, first of all, thank you for having me on. I think the world is finally waking up that we cannot ignore this, whether it be a public health issue, a medical issue, or even a business issue. And I'm optimistic that we are now finally having the discussions and taking the actions that we really needed to do to address this.
Do you think that we're going to bend the curve? I mean, you look at some of the numbers in Italy, you've looked at some of the numbers in South Korea and elsewhere. Where do you think we really stand?
Well, I think, first of all, there's a tremendous misconception about bending the curve. This virus is likely going to be here until we have a vaccine, which if I were to be optimistic, I'd say 18 months. And every time we try to bend the curve, as you discussed, we're suppressing cases, but all we're doing is postponing those cases. We're not eliminating them. And so I think the challenge is how many cases can we suppress or prevent until we get a vaccine? I hear this notion that we'll be in it till April and then August. I think we're going to be in this for many, many months. We have to bend the curve every day, not just one time.
Well, look, the great conundrum is the more you try to bend the curve, the longer this actually is going to take place for, and the more, arguably, hopefully, will help with the human damage, but we will also create economic damage. And so there's going to be this very complicated, I hate to say that there should even be a balance, because I think that the human element is so critical here, and nobody's going to, I think people are going to say whatever it costs, but that's where we are.
I think you said it very well. We have to continue to consider what it means to die from this virus. It's a very, very difficult and tragic situation. We also have to have a conversation about how we're going to live with it. And we have to figure that out. Are these kind of measures that we're taking right now, do they work? Number one. And number two, do we envision America that for the next 18 months will be in complete lockdown? Right now, we just heard the numbers from China. And as soon as China goes back to work and people are back on subways and trains and all the different forms of transportation, and when they're cheek to jowl in manufacturing plants, when they're in public places, I, for one, believe that we're going to see a resurgence of cases back in China.
Have we made a mistake then? Is this approach a mistake? I mean, what you're advocating right now sounds like it's a little bit like what Boris Johnson was doing up until about 48 hours ago.
No, I'm not suggesting that we shouldn't try to bend the curve. What I'm saying that is, just as you articulated so well, we have a natural tension here. Postponing cases means that they're just going to happen later, which means that we continue to drag this out. That's the hope. We have to do that. But the hope also includes having a vaccine and that one day will get us out. Otherwise, eventually, the 20 to 60% of Americans that we believe will get this. And so our hope is that we suppress it, but we will only be saved really when we have a vaccine.
Hey, Michael, I get your point, and I agree with you 100%. I understand about trying to bend the curve, but if you're right, and if this lasts for 18 months, and every time anybody leaves and goes back to school, goes back to home, or goes back to work after that, you almost start to think that you're better off getting sick earlier rather than later, before you've seen the healthcare system overrun while there's still, ventilators around, while there's still beds around.
You asked me at the top of this interview, what's the good news? Just the very fact that you just said that, that's good news. We're starting to think about this in a much more realistic way. It's not knee-jerk. It's not pie in the sky. It's not we're all going to die. And it's not a problem. This is hard. This is really hard. But we can get through this. But we're going to have the very discussion that you just articulated so well. We have to learn to both how we're going to die with this virus, but also how we're going to live with it. And that's, to me, the most important message today.
Okay. Well, Valerie, don't queue up the next one. Let's unmute everyone.
Ongoing.
And then,
we are
sorry.
talking with independent business owners dealing with
All right.
Okay, well, and now I think I need you to